When having an operation, it's important that the body's blood sugar is maintained in a normal level, usually less than 125. Patients with diabetes have high blood sugar to begin with, but all patients can have blood sugar greater than 125. When blood sugar is elevated, it increases the risk of a surgical site infection. Maintaining euglycemia, or normal blood sugar, is important in reducing the risk of surgical site infection. In SCOAP, there are two metrics that relate to euglycemia. The first is how often patients with diabetes actually have their blood sugar monitored at all. The second is whether or not a blood sugar of greater than 200 was responded to by the starting of insulin. Although there's some debate about whether or not 200, 150, or even 125 is the right level to start insulin, we all agree that once blood sugars get above 200, they are critically elevated, and that's the metric in SCOAP that we follow. When interpreting a SCOAP report, if your hospital is underperforming in these two metrics, it requires a response. The best response may be to create a multidisciplinary team, anesthesiologists, surgeons, even sometimes an endocrinologist, that can help raise the importance of these metrics at your hospital, but also create a plan so that all patients with diabetes have their blood sugar monitored and all patients with elevated blood sugar have insulin started. When talking with surgeons, it's important that they understand their role in improving these metrics. That role involves having better communication with the anesthesiologist, but also being involved in the SCOAP surgical checklist, in which both these metrics are called out specifically. When speaking with administrators, it's also important to recognize that these metrics are key to improving efficiency, as patients who have elevated blood sugars have a much higher risk of surgical site infection, and this increases the cost of care and also the amount of time that patients are in hospital.